Welcome. Today we're going to get started on personality disorders. So to switch things up, I'm going to go ahead and ask a few questions before each section, and we'll see how it goes. So first, two social motivations associated with personality disorder. What are two social motivations associated with personality disorder? Number two, what mnemonic is used to describe 10 symptoms of personality disorders? What mnemonic is used to describe 10 symptoms of personality disorder? And which personality disorder is arranged into cluster A? Which personality disorders are arranged into cluster A? And we'll get those answers later on. So before we start talking about personality disorder, we must first define personality. So personality is the manner in which we think and behave, and those two features will define who we are and make us unique from one another. Now, another important definition to think about is temperament. So temperament is the manner in which we behave or the emotions that we exhibit. So for example, someone who remains calm and doesn't get mad easily would be described as having a calm temperament. And then to further describe personality, these two guys, McCrae and Costa, they created a 5-factor model. And this 5-factor model, as you can see here in the top right, is just a group of 5 personality characteristics. When you combine them, they lead to our individual personality. So we had previously described personality as the manner in which we think and behave. So personality disorder is inappropriate pattern of thinking and behavior that will lead to severe dysfunction in many facets of that individual's life, as we'll see here shortly. So two more definitions that we'll probably be expected to know is ego dystonic and ego syntonic. So I want you to think of ego as some, like from previously with the id, ego, superego, those were thoughts in your head. So ego dystonic is going to be thoughts that are dis, so they're not in unison, so they're conflicting thoughts. Whereas ego syntonic are going to be thoughts that are in unison. So the people with ego syntonic will not know that they have a problem, and those people will often delay or never seek any treatment. So to begin speaking about personality disorders specifically, there are two really big characteristics that are associated with personality disorder. Now first, you got to know that people with personality disorder are at higher risk for developing additional mental disorders. So it's usually an early onset of a more serious psychopathology to occur later on down the road. Additionally, people with personality disorder are typically not diagnosed before the age of 18. So this isn't like those pediatric psychiatric conditions. These are going to be the older individuals that are going to come in and be diagnosed with personality disorder. So there are two key social factors that will impact how a person acts or their personality. The first is affiliation. And affiliation describes how we affiliate with others. This is our desire to have close relationships, to have many friends, to want to seek affection with someone else. And then the second is power. This is the desire to exert your male dominance, to be the queen bee, and to overall just be a powerful person. And it's believed that many people with personality disorder have inappropriate variations of these two social motivations. So people will have inappropriate affiliation. They will want to be in isolation. They won't want to associate with others, etc. Yeah, I'm not gonna lie, I don't really know what this slide is saying. All I can see is that these people lack empathy. They can't share people's feelings. Other than that, it just seems like a lot of words to me, so I'll move on. So DSM-5 segregates these personality disorders into 10 specific types. And these 10 types are divided into 3 clusters, which each cluster has its own set of characteristics, which is how it's organized, which you'll see here in the next few slides. So I can almost guarantee we're going to have to list or memorize these three clusters in some way. So for cluster A, these individuals are odd or act eccentrically. So odd behavior always associated with schizoid. And there's two types of schizoid. There's schizoid and schizotypal. And then paranoid individuals I also consider as acting oddly. Now for cluster C, these individuals are fearful and anxious. So individuals with dependent personality disorder, they need to be taken care of. So this leads to submissive behavior, and I think submissive as they're scared of things, so they're submitting. So that's how I remember dependent. Avoidant, they're fearful, so they avoid things. And then OCPD I consider as the anxious characteristic. So for me, A and C are easy to associate the disorders with the general theme of the cluster. And then cluster B, I'm just going to basically say whatever else is in an A and C fall into cluster B. And hopefully that works out. You guys can memorize it however you like. Now the signs of personality disorder are described by the mnemonic BAD shape: borderline, antisocial, dependent, schizoid, schizotypal, histrionic, avoidant, paranoid, passive-aggressive, and empathetic disorder, not narcissistic personality disorder. And we're going to get into each of those individually here. Now those representing BAD. So BAD is borderline. These individuals dread separation. The antisocial describes individuals that are, well, they're antisocial, but they also are described as violating the rights of others. And then dependent is easy. They depend on others for guidance and emotional support. Now the shape portion of the mnemonic, S is for schizoid. So these individuals are not friendly, they're withdrawn, and they're difficult to engage with. So it kind of sounds like me when you first meet me. So S, Steven, schizoid, whatever. And then you have schizotypal. I consider these like a type of schizo, so they're not fully schizophrenic. They have nearly psychotic mannerisms. Now with histrionic, these individuals exaggerate. So I think of exaggeration like people exaggerate history sometimes, so histrionic exaggeration. Now an avoidant, they avoid social relationships. The P is paranoid. They are suspicious to others, but not psychotic. There's also passive aggressive. So they use passivity to express angry feelings. And then empathetic narcissistic personality disorder. These individuals cannot empathize. Now to review the answers from our pre-section questions. What were the two social motivations associated with personality disorder? What were the two social motivations associated with personality disorder? Those were affiliation and power. And then what mnemonic is used to describe 10 symptoms or signs of personality disorders? And that was BAD shape. BAD shape. Remember there's two S's and two P's. And then which personality disorders are arranged in the cluster A? These individuals are odd and eccentric, so schizoid, schizotypal, and paranoid. So now we're going to talk about each cluster in detail. So to test yourself before we get started, describe the difference between schizoid and schizotypal disorder. Describe the difference between schizoid and schizotypal disorder. And then what is the difference between OCD and OCPD? What is the difference between OCD and OCPD? Okay, beginning with cluster A, we have paranoid personality disorder. Paranoid personality disorder. And this is exactly what you expect. They are suspicious of others and they have an expectation of being harmed. Pretty self-explanatory. And cluster A also has schizoid and schizotypal. So with schizoid, it's important to remember that these individuals have diminished emotional as well as social features. And this is going to be big because the biggest difference between schizoid and schizotypal is in schizotypal, these individuals have peculiar behaviors but are not out of touch with the reality. So they do not have emotional restriction or social withdrawal, but in schizoid they do. Moving on in cluster B, we have antisocial personality disorder, and this disorder begins in childhood and leads to a disregard for the rights of others. These individuals are impulsive and they frequently break the law. However, this is also a condition that's overdiagnosed in the poor and underdiagnosed in the individuals of higher socioeconomic means. And it's because people with this disorder may appear charming under the right circumstances. This condition is also associated with very poor parenting or children who have been abused during childhood, further adding to the risk of breaking the law in the future. Next up in cluster B, we have borderline personality disorder, and these individuals live on the border between two different moods, so they can frequently jump from one side to the other, from happy to sad. This also leads to poor control over impulses, so these people are more likely to get involved in fights and also at high risk of sexual behavior, or take place in high risk sexual behavior. Another one from cluster B is histrionic personality disorder. And if you remember before, I associated histrionic with history. History is full of exaggeration and people who love the attention. Presidents love attention. History is all about presidents, about kings. These people love attention. They're also manipulative. So, helps you remember histrionic is full of attention-seeking people who tend to inappropriately exaggerate. To close out cluster B, we have narcissistic personality disorder. Now, for me, the best thing to describe this is Cersei Lannister from Game of Thrones. She thinks very highly of herself. She has a pattern of grandiosity. She also can't empathize with the people of King's Landing. She exploits them in any way possible. And she also wishes to retaliate about anyone who criticizes them. So, say something bad, lose your head. Narcissistic personality disorder, think of Cersei Lannister. The easiest group to really understand is cluster C. To begin, we have avoidant personality disorder, and these people have social discomfort and they're extremely timid, so they avoid persons, avoidant personality disorder. Now with dependent personality disorder, these individuals cling on to others, they're dependent on others. And not only are they dependent, they do not want to separate from those other people of whom they're dependent. And this leads to a submissive type of behavior. Because if you're dependent on somebody, you can't be in charge, so you must submit to the people of whom you're dependent on. Lastly, we have OCPD, Obsessive Compulsive Personality Disorder. These individuals love order, they love details, and they love rules. And they also need to control the environment. They do not like uncertainty. Now this is different from OCD in that people with OCD, they understand that what they're doing is abnormal. They know that they should not be doing this behavior, however they need to satisfy those compulsions or those obsessions. However, in OCPD, they don't have that recognition of what they're doing is abnormal. They don't even know what's going on. They're just doing it. With regard to this slide, all it's really saying is people with personality disorder don't typically change. And it's even less of a optimistic prognosis for those with schizotypal and schizoid personality disorders. Now to answer the questions from the beginning of this section, describe the difference between schizoid and schizotypal disorder. Now, if you remember, schizotypal focuses on peculiar behaviors rather than emotional restriction or social withdrawal. So schizoid has everything, that peculiar behavior, emotion, and social withdrawal, where schizoid typal is a type of schizoid, so it only has one subsection, so it only has the peculiar behavior rather than emotional and social characteristics. Now, question number 2, what is the difference between OCD and OCPD? If you remember OCD, they are aware that their behavior is inappropriate. However, in OCPD, they are not aware. So let's dive in deeper into a few of these. Some more questions to begin this subsection here. Which personality disorder is associated with short periods of mild depression and hypomania? So which personality disorder is associated with short periods of mild depression and hypomania? Number 2. Patients with a primary relative of schizotypal disorder are likely to have what other associated personality disorder? So a patient with primary relative of schizotypal disorder are likely to have what other associated personality disorder? And lastly, what is a term that can be used to describe a patient that will not seek treatment for the disorder or may prematurely terminate treatment regarding their personality disorder? So what term can be used to describe a patient that will not seek treatment for their disorder, specifically referring to personality disorder, or may prematurely terminate said treatment? So DSM-5 defines schizotypal disorder based on accounts from family members of those who had been diagnosed with schizotypal disorder. Schizotypal is, remember, this is the one that emphasizes they act eccentric and peculiar, and this is in contrast to schizoid disorder, which has the peculiar behavior as well as social and emotional detachment. So I know it says here emphasizes social detachment, but this is contradicting what I said earlier. So I'm going to leave it where schizotypal specifically refers to the eccentric and peculiar behavior, and schizoid would be the one that had the social and emotional detachment. But you could choose yourself how you choose to memorize these two disorders. Schizotypal disorder also has a high degree of genetic correlation between likelihood of developing the disorder. They found that first-degree relatives of schizophrenic patients have an overall higher likelihood compared to the normal population. And there's also a higher rate of paranoid and avoidant personality disorders in those who have a primary relative of schizophrenic patients. Next, we have borderline disorder. Now, borderline personality disorder presents as a set of personality traits, and these traits are commonly associated with other psychiatric illness. For example, cyclothymic. And if you remember, that's short stints of depression as well as hypomania. And if you remember, I said before, borderline disorder is just people who live on the border. They go from happy to sad, and this is a perfect example. They go from depressed to hypomanic, and this leads to overall poor impulse control. And because it's associated with so many different disorders, it's also a very commonly seen and commonly treated personality disorder. Now, DSM-5 defines borderline personality disorder based on a progressive instability in mood. And when you have an unstable mood, you're going to have poor interpersonal relationships. And this is going to affect your self-image because you're not going to have anyone to bond with. So I kind of think of them going from A to B to C. However, they can all be intertwined independently. And then it's also, we remember before that borderline disorder is associated with many other psychiatric illnesses such as depression and substance abuse. The cause of borderline disorder is a mixed bag of genetic predisposition as well as certain factors during childhood may also precipitate this disorder, such as abuse or neglect during childhood. Treatment of borderline disorder is quite difficult, and most patients who begin treatment will have a premature decline in the effectiveness of their therapy. However, the most effective available treatment modality is DBT, dialectical behavioral therapy. In DBT, it places an emphasis on informing the patient on how to deal with their strong emotions and how to become comfortable in the fact that they will have strong emotions. And this has been proven in previous studies to be more beneficial, more effective compared to controls where they received other types of therapy. And because borderline disorder has such a high attrition rate, clinicians will try to basically throw the kitchen sink at them as far as medications. You can use anything from antipsychotics to antidepressants to anticonvulsants. Basically, you name it, they've tried it, along with DBT therapy. So now we're going to move on to antisocial disorder. And this disorder has been well studied over a really long period of time. To diagnose antisocial disorder, the symptoms have to be present before the age of 15, and they must have at least 3 of 7 total signs after the age of 15. Additionally, antisocial behavior has been defined as occurring either transiently or non-transiently, meaning it either comes and goes, or it's just a constant span of antisocial behavior. And again, as has been the case with many of these other disorders, antisocial disorders associated with a mixture of genetic and environmental factors, meaning that people who grew up in a worse childhood home are more likely to become antisocial in the future. And this is also kind of saying the same thing as before, that along with genetic factors, there's also family processes which go along into predisposing these children to antisocial disorder. And the last real factor that they associate with this disorder specifically is the inability to associate their behavior with the potential punishment that can result. So without the fear of consequence, these individuals will continue to act in an inappropriate manner. Now, if you get a patient who presents with antisocial disorder, good luck in treating them, because there has been no real treatments that have been found to be effective in this disorder. And to make things worse, they rarely even seek treatment to begin with. The majority of patients that do present for any kind of treatment is doing so because they've been mandated by the court systems themselves. And the reason why these patients often do not seek treatment is because they are egosyntonic, which means their personalities are in unison, so they don't really realize that there is a problem going on. So treatment of basically all of these disorders that we've discussed is a mixture of DBT and medication. So for borderline specifically, you're going to use an SSRI, or it says here naltrexone if they're a drug abuser. Just remember naltrexone is about $1,500 per dose, so good luck getting people to pay for that, especially if they don't even realize they have a problem. Now, treatment of the last two disorders here, narcissistic personality and antisocial personality, is going to be psychotherapy. Simple. Now, the answers to our questions from before. You remember which personality disorder is associated with short periods of mild depression and hypomania? And if you remember before, that was borderline personality disorder. Remember, they're borderline, they're in between two extremes. So in this case, it's mild depression and hypomania, which is cyclothymia, if you remember that from before. Number 2, patients with a primary relative of schizotypal disorder are likely to have what other associated personality disorder? And that's going to be paranoid and avoidant. Paranoid and avoidant. And lastly, the term that can be used to describe a patient that will not seek treatment regarding their personality disorder or may prematurely terminate treatment is going to be egosyntonic. Remember, their thoughts are in unison, so they don't realize they have a problem, thus they will be less likely to seek treatment or may prematurely terminate treatment. And thanks for joining me. Don't forget to go manic on that like button, alright? And if you haven't subscribed yet, I'm keeping a tally, so make sure you subscribe, alright? See y'all.